Okay, so I'm literally filming this in the car line because it just seems like a perfect time to do it. I got 30 minutes. So it has been 6 weeks, 6.5 weeks since I had my lower lumbar discectomy on my L4-L5. Just to kind of fill you in a little bit, I woke up with paralysis of my L4 nerve. L4 nerve, yeah. All the way down to my toes. And I freaked out when I woke up, and ever since then it's been like getting better. I've been on a lot of steroid packs, steroid injections. They stopped me after my third steroid dose. They're like, you can't take anymore. So I'm stopping that for, they say like you can take one a month, but I took like 3 doses in a month. And it helped a little bit, but it didn't fully fix the issue. So my physician's assistant, I saw her before I went to a wedding recently, but I saw her before that wedding, and she wanted me to go to PT. So I ended up going to PT to work on my foot drop, and my foot drop only. I'm not released yet to do anything on my back. But I was very doubtful that PT would help. But it has helped tremendously. So what I'm doing is I'm doing like hot baths on my foot where the nerve's dead and or paralyzed. It's not dead, it's just asleep, and we need to wake it up. So I'm doing hot baths on that, and then like directly after that I'm doing ice baths to just try to get like my brain to connect and send signals down to the nerve so it keeps working. I also am doing TENS unit stuff on my L4 nerve pathway to strengthen my muscles, because my muscles are not working on my calf and the top of my foot. So we need to keep those strong so that when I do get feeling back and when everything starts connecting again, that the weakness won't be there. So I'm doing that, and that's actually helping a lot with just strength. I'm also stretching out the back of my calf, because I guess a normal, like when you walk normal, it naturally stretches the back of the calf out, and I don't walk normal. So I'm doing a lot of stretches on the back of my calf, and then just trying to do like they like massage my leg with a whole bunch of different desensitization things to try to get feeling back and like my brain connecting. And a lot of balance things, because I can't balance right now hardly at all on my left leg. So we're working on a lot of balance. So I've been doing that, and let me tell you, when I first started walking into physical therapy, I was walking like a prancing, like this foot would just like, I look like a prancing horse on my left leg. Like my thigh was overcompensating for my weakness in my foot, and like my foot not responding. So I'd like hike it up and then like let it drop. So that's how I was walking. And so now I walk pretty much normal. Like, it doesn't feel normal to me, but it looks way more normal than I was walking. People don't notice it much anymore, which is great, because I was really self-conscious about it. And I wear a like a leg brace too, for foot drop, and it goes like all the way up my calf. So I don't like wearing that out in public, and I wear that just to like keep my foot straight and kind of help stretch it out for a couple hours a day. But I don't wear it all the time. Yeah, but it helps me walk faster, because if I don't have the foot brace on, I walk really, really, really slow. So it's ugly, but it helps. It works. However, there was this like one incident where like I was helping my husband put some Christmas decor away, and he was like, "Where's the Christmas tree box?" And I was like, "Throw it down the stairs. Like, it's up there, but just throw it down the stairs." And I had reflexes and like twitched my back, and then I was like, "Oh, that didn't hurt. Like, it felt fine, but I don't know. It was a stupid mistake. Like, why did I put myself close to the box to like do a reflex and like twinge my back? I don't know." But I was scared that like I hurt something, and then like really soon after that I started getting burning feelings down the back of my legs, which is like your L5 nerve pathway. like L5, S1. And I was terrified that I bulged another disc, like living in absolute fear that I bulged my other disc, or I re-herniated the one that I just had surgery on. But then like it wasn't persistent, and like the feeling would kind of come and then like go away and then come and go away. I've also had really bad facet joint pain, which it was like starting to progress again, but right before my surgery. So I knew that that was something that I was going to deal with, but like was looking forward to a facet joint injection with steroids to help, because the first facet joint injections that I had lasted almost a year, which was amazing. So I'm really hopeful that that will help again. I have a lot of bone spurs on my facet joints, so they get really irritated, and back pain just sucks. So I saw my surgeon today, and he reassured me that like surgery went absolutely perfect. He said like nothing looked crazy irritated when I was in there. I think your nerve was just really mad from being moved. And he's been so good about being so thorough, because I've been living in so much fear of just like, is this my new life? Like, what's going on? So I forgot about this. I had a nerve conduction test, just to see where the nerve was damaged, how much of the nerve was damaged, if healing was happening. And yes, there is nerve damage. Damage did happen. They think it was like after surgery, once a whole bunch of blood flow went to my nerve. It just didn't like that, and it didn't like not being pinched anymore. So something happened, and the sheath is like, they said irritated. And but the nerve conduction doctor, she said that there was healing showing, and she said at the rate that it looks and like how far up it is on my back, that it'll probably take a year to 18 months to heal by the rate that it's healing. My doctor reaffirmed all of that and said that, you know, he's super hopeful that it will regain all feeling, which is good. I'm crying because this is like such a roller coaster of just like ups and downs and ups and downs. So I'm hopeful for that. I keep putting my mind to just 18 months in the future, because if I do it like month to month, then I'll just be let down. So I'm just going to put like a full 18 months in the future and just hope that my foot drop will heal itself, and I'll be able to walk normally again, and I'll be able to do things again. I brought up the burning on the back of my legs, and I was like, I'm scared that like I herniated another disc or bulged another disc or whatever. And he's like, I don't think you did. I absolutely don't think you did. He said a lot of my patients have like a flare-up 6 weeks after surgery, and it's just like an increase of blood flow and a lot of pressure and a lot of healing going on 6 weeks after surgery, and I think that's what you're dealing with. So that's why you're having some nerve pressure issues. And so I was like, are you sure? And he's like, yeah, I'm sure. I think you'll be fine. But if things persist for more than a month, then we'll go ahead and do another MRI. I had an MRI right after surgery because of my foot drop. So he wanted to make sure that there's no pressure or anything on the nerves. Everything looked good. My discs looked great. So he said if the burning persists, then he will do another MRI and we'll kind of go from there. But he does not think that I bulged another disc. So I'm trusting in that, because I'm more pessimistic. And something traumatic just happened to me, you know? So I'm not trusting my body fully right now. But I feel great after today's visit, even though I'm emotional. My doctor doesn't think that I'll be tied down from all this anymore in the near future, which is something that I've tried to come to terms with, that like this is my new life. Like I can't do normal things anymore. I'm not going to be able to like go kayaking or hiking like I used to. Just because I haven't been able to for a long time. And so, and he doesn't seem like that's my future. So that's really hopeful. So I'm trusting in his expert opinion, and he does this all the time, and he deals with people that have worse issues than me. And so, I think that's something that would be really cool, just to be able to do the things that I love again. I can't see that yet because I'm in bad shape right now, but I'm looking forward to a day where I can make a video and show you guys that I'm doing the things that I used to do. It's just hard when you're in it, in the middle of it. But I do have like complete faith, and I think that's what's helping me get through, is my relationship with the Lord and trusting in him no matter what. And I know he has me where I'm supposed to be. He's already put so many people in my life just in the past 6 weeks that have truly been fantastic and encouraging, and just people that I've helped encourage as well. So I know that even if this is my life forever, that God will use it, and if this is not my life forever, then I'll continue to share what happened and how faithful he is. So yeah, emotional, that's where I'm at. It's just up and down, but the last couple weeks honestly have been great. We went to one of my husband's best friend's weddings, and we had the time of our lives. It was great. I wore a really long dress and wore really comfortable shoes so that people couldn't tell like what was wrong with my foot, and nobody did notice, and that was great. And then I threw one of my best friends a baby shower this past weekend, and that was so much fun, just being able to distract my brain and like prepare for that and get ready for that. And it was beautiful. And so that was really fun. And then my sister is coming into town tomorrow, in 2 days. And so I think that that'll be really fun too, just getting my mind off of things and looking forward to small things, even though I can't do a lot right now. And I feel helpless because I can't really clean up the house. I can't bend down or do anything. I have this like little handle thing that has a little clamp on it, but like other than that, I can't lift anything over the 10 pounds. And so things are pretty difficult at the moment. But the other day my daughter did tell me, she said, "Mom, I feel like you're getting back to normal, and I feel like I have my mom back." And that was really nice to hear, that even the small things that I can do, she's noticing, and she's feeling like she has her mom back, because for a long time, you know, I haven't been able to do things. And so that's good. That's good for her to notice, even small improvements or huge improvements. So I hope your surgery recovery is better than mine, but if it's not, know you're not alone. It's a really long, hard recovery, and I did not expect it to be this hard and this trying and this long. But we can do this. We got this. We're good. So I will update you in the next video. I don't know when that will be, because kind of from here on out, I'm kind of just getting my steroid injection in my facet joints, and then after that it's just like maintenance PT on my foot drop until things start healing. I guess I will update if the burning on the back of my legs goes away or not, or if I get another MRI to make sure I didn't bulge a disc or whatever. But if there's any changes in my foot, I will let you guys know for sure. I really do need to get like photos or videos of me like walking around or something. Maybe not. You don't want to see that. All right, I'll see you guys later. Bye.